Chronic illness can frequently present with a variety of conditions or illnesses that seem to be unrelated. Today we're going to talk about a 68-year-old lady with arthritis, anxiety disorder, heart valve disease, and fluid around the heart. It's very interesting how these seemingly unrelated conditions can all tie into one health issue with one critical intervention. Welcome to Montgomery Heart Wellness Clinical Rounds. Today we're going to discuss an interesting clinical scenario with a 68-year-old lady with a variety of health conditions. Camille, can you share with the audience what we're going to discuss today?
So this woman, we'll call her Dee Dee. She came to our office. She was 68 years old. She had high blood pressure. She had systemic arthritis that caused daily significant pain that was hard to control. But she also had insomnia, anxiety, depression, some prior history of biliary pain or pain, in the gallbladder, liver system. And she had heard about kind of the approach we have, which she hadn't tried before, just changing her diet rather than trying new NSAIDs for her pain and that kind of thing, like more Advil or aspirin or things like that. And so she came here to try to learn how to change her diet.
I can think of maybe 5 or 6 different medications to treat those different conditions.
Yeah.
And so you think anxiety, insomnia, those are maybe somewhat related, but they're certainly different than arthritis, and it's certainly different than fluid around the lungs. And you mentioned heart valve disease or something?
We had found moderate mitral valve regurgitation, which is probably caused by her uncontrolled hypertension. And we found she had an effusion or fluid buildup around the heart.
We frequently see patients come in who have a variety of illnesses, and sometimes it's even worse than this. Issues relating to the liver, issues related to the kidneys, the heart, there may be some brain dysfunction, and sometimes medical professionals refer to patients who are very sick with a lot of complex illnesses as quote-unquote train wrecks. So she wanted some alternative approach, and so she felt that, maybe nutrition could help. So what was the approach we took? We got some tests, I imagine.
Yeah, and in her testing, she had some borderline high LDL, so her bad cholesterol was 100. That's not horrible, but could be better. She didn't eat the cleanest diet at the time, and she was obese with hypertension. Her liver enzymes are actually okay, but that doesn't mean there's no liver inflammation or damage going on. If the liver enzymes go elevated, that's some sign of more progressed damage. Or even if they're too low, that could be scarring.
Yeah. Elevated liver enzymes are typically a sign of an acute insult to the liver. Yeah. So the liver can be inflamed, and so when the cells are inflamed, the membranes become leaky, and the enzymes which are inside the cells leak into the bloodstream, and that's why we can pick it up on the blood. But when the liver cells progressively fail, get sick, and slowly die and fail, they don't have to be acutely inflamed, so they won't necessarily release these enzymes, but they become dysfunctional, so they don't make as much protein, they don't clean the blood out, so you build up ammonia, so you can have progressive liver failure without increased enzymes. So I'm not saying she had liver failure, but again, this is something we don't rule out, even though the enzymes are normal.
The main thing was her echocardiogram finding of pericardial effusion and the moderate valve leaking. We tried to figure out more causes, like make sure there was no autoimmune disease causing that effusion, some of the autoimmune screening came back normal, but that doesn't mean there wasn't inflammation. I mean, just on our first visit with all of her symptoms and everything going on, the first thing we think of is a huge state of inflammation, right?
Exactly. So we didn't see a lot of markers in the blood showing inflammation, so it certainly wasn't a lot of spillover systemically or widespread, but clearly there was something going on with the heart. And, the pericardial effusion is a condition where there's fluid buildup around the heart. So the pericardium is sort of a fatty tissue that surrounds the heart. It actually serves as protection of the heart as it sits into the cage. So the heart has a protective sac. We call it the pericardium. Now, in the normal setting, this sac sits just on top of the heart. So just think of like your pocket that sits flat. There's a potential space there, but that's if there's nothing in the pocket, then it sits flat against, say, the shirt in this case. In the case of the heart, the pericardium sits flat against the heart muscle. So when we look at an ultrasound of the heart, we can see the pericardium, but there's just the pericardium sitting against the heart muscle. However, if swelling develops in that pericardial sac, or bleeding or something develops inside that pericardium, which is outside the heart itself, but inside the protective sac of the heart, we call that an effusion. The effusion is a buildup of fluid within that sac around the heart. And in some severe situations, if that effusion builds up to a large amount, it can actually compress the heart and cause what is known as cardiac tamponade. The blood pressure drops, and if you don't insert a needle in that emergently and drain the fluid from around that cavity, it can compress the heart and the patient can die. She had a small to moderate amount of fluid. However, it wasn't so much the problem that was being caused by the effusion, but the concern was, why was the effusion there? So what was the cause? And so we wanted to make sure we knew what the cause was, because understanding the cause is probably more important than treating the infusion itself. So we got a lot of tests, as you mentioned, looking for inflammatory causes. This patient had arthritis. So we tend to think of arthritis affecting the joints, the knees, elbows, wrists, etc. But the arthritis can affect other parts of the body. So the joints have connective tissue, but can affect the connective tissue in other parts of the body. I mentioned the pericardium is connective tissue. There are other parts in the heart that's connective tissue, such as what? The heart valves. This patient had quote-unquote swelling around the heart. So the question was, that related to the arthritis? And of course, there were other things going on too. And could a nutritional intervention help with all of these things?
We really went into detail about the nutritional regimen we recommend and kind of explain the science behind it. And with this going on, we definitely needed her to do the raw plant-based diet for at least a month, and she gave us a month, and she did really well. She wanted those heart abnormalities to go away just as much as her arthritis. So she did really well. So in a month, she lost 7 pounds, which is about 4% of her body weight. And her blood pressure had improved. Her very first blood pressure was 156/79, and the last one was 126/80. And we redid that echocardiogram. And that echocardiogram now only showed mild valve leaking. The effusion was completely gone. And one thing she felt a lot better of, because she never really had a lot of symptoms that people can have of an effusion, like
Gotcha.
orthopnea, trouble breathing lying down, or coughing, shortness of breath.
How did her joints feel?
They felt a lot better. Like, her joint pain was significantly better, so you could tell her mood was better because she was feeling great every day. She could actually do the things like go walk outside with exercise with her friend, be more active, and just enjoy life better.
Was she sleeping better?
Yeah, she was. And she had insomnia, and so she didn't sleep much. She had trouble staying asleep. I think eating healthier helped her body just get more of the vitamins and minerals for her body to be able to rest better at night. I believe exercise regularly helps, and she is exercising more with less joint pain. And she did some other things, meditation, magnesium at nighttime.
I want to really emphasize some of the things you pointed out because, one, she presented with evidence of systemic arthritis. Even though our blood test didn't show any abnormal findings, she had joint pains throughout her body. That's one. Then she had valvular disease and also what we call pericardial disease. With just 30 days of nutritional detox, her joints felt better. The effusion around the heart had gone away, and the leaking in the valve had subsided significantly. So there we have evidence of inflammation in the heart and the joints subsiding with just one therapy, a nutritional intervention. And oh, by the way, did you put on a sleep medicine or an anti-anxiety medicine? Because those things got better too.
No, yeah.
Yeah, that underscores the fact that optimal nutrition puts you in biochemical and physiological balance, which really corrects a lot of things. And so her anxiety and insomnia, I think, were due to biochemical and physiological imbalances. And once her body became biochemically and physiologically balanced, she slept better, she was less anxious, she was able to exercise better, her joints felt better, her heart worked better, and the swelling around the heart subsided. Optimal nutrition, particularly a raw plant-based diet, reduces inflammation, reduces oxidative stress, and it has what I like to refer to as a pleiotropic effect. It has multiple positive benefits at the cellular level and the tissue level that helps the body heal, and that's why this is such an important therapy. And here's another example of how this affects the body. Any other comments with this patient?
Yeah, one thing I forgot to mention, she did lower the LDL by 21% from where it was, so from 100 to 79, and that's a lot to do in 1 month. And her total cholesterol dropped by 15%, so that was just another thing that got better.
It's important because the total cholesterol was considered to be in the quote-unquote normal range, and it became significantly better or significantly lower. Now, lower is not always better in some situations, but so significantly lower, which means that her normal was probably a lower cholesterol, and as she continues with this lifestyle, these numbers may, correct even more. So it's always good to sort of follow how she's doing. And again, another example of how someone can apply one powerful intervention that has multiple effects across the spectrum of the body. Well, I hope you learned something today. I certainly did. And again, as always, if you have any questions or comments, leave them in the comment section. We hope you find this to be informative. Until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification